Hi and welcome to the latest expert video series. Today we welcome Fiona Daly, Deputy Director of Estates for NHS England. Fiona is responsible for leading the strategies, the procedures, the policies for everything from operational resilience to patient experience and of course developing the 100,000 plus workforce in FM in the NHS hospitals today. Welcome Fiona, thank you for your time.
Thanks for having me.
Can we start off, Fiona, please, by telling us a little bit about the workforce plan and the key strands of the workforce plan that was fairly recently published?
We published our Estates and Facilities workforce plan in summer last year, and there are essentially 4 strands to that plan. We wanted to keep it quite simple and focus on the areas we think that we can make the biggest impact in. So the first is around developing our people. So we have an incredible workforce currently, but those people need development, they need career opportunities. When we're recruiting people in, we need to consider that. We'll probably touch on that more a bit later. We've clearly just come out of the back of an immense period in the NHS through the pandemic, so the wellbeing and health and wellbeing of our people is really important, and that's a core strand within the strategy about how we care for our staff and look after them. Equality and diversity and inclusion, really critical part of what we want to do. We know that there's an imbalance within our workforce, both a gender and from a black and ethnic minority perspective, so we really want to improve on that. And we need to build the next generation. 41% of our workforce is over 55 and we need some people coming up behind, so we really need to focus in on that and help to grow that new generation of people who are going to be the next us. So
let's pick up on some of those issues then. So the drive for a more inclusive culture, a more inclusive environment. Talk us through some of the successes and perhaps some of the initiatives that are underway.
I think we've really dug into the data, and anybody knows me will know I'm a big lover of data. So we know that we've got issues around band 4s, for example. So band 4 seems to be the ceiling in terms of gender equality, and we've done a lot to increase the balance. The NHS has never been, we've never had more diverse workforce in the NHS, but it doesn't seem to be translating into the estates and facilities workforce. Okay. So we want to kind of address that balance and get more people, especially females, into leadership roles. So we're looking at how we can do that in a really practical way, and data is one of the ways that we can do that, we think. With the ICS estate strategies that are currently being developed, we are really looking at how we integrate our new dashboards and our data into that, and there'll be a real focus on equality and diversity and inclusion in that. Working on aspirational targets, so you'll know that recently NHS England published its equality, diversity and inclusion plan, as well as the long-term workforce plan for the NHS, and within that there's a real aspiration for everybody to improve on the gender balance and black and ethnic minority balance within our workforce, and also reflect the demographic populations in which those organisations operate. And we're going one level deeper within estates and facilities, so we'll shortly be launching our aspirational goals within estates and facilities, which will look at taking those principles of both of those plans and really embedding it for our community.
It'll be interesting to see those when they come out, because I know in companies like ours at Sodexo, we're equally striving for that gender equality and that balance, and we're making some good inroads, but it's great to see the NHS doing that as well. You touched on wellbeing and ICSs. Let's just tackle those two then. So
sure.
Talk me through some of the wellbeing initiatives that are underway.
There are a bunch of wellbeing initiatives nationally and at a local level. I think one of the things that we really need to focus on is how our staff access those offers. So as you know, a lot of our staff don't have access to mobile phones, don't have access to computers, they're not desk-based necessarily. We need to see how we can get the offers that are on offer to those people, and I think that's a real fundamental. We're always looking at how we can get the right information to the right people at the right time so that people can make use of those. We have been doing a lot of work at NHS England on mental health and improving the mental health and wellbeing of people. That's from a number of factors, culturally, from a recruitment perspective. Younger people are struggling more with their mental health, and we want to be in a position to support those people, but it's not just younger people. We've, as I said, come out of the back of a really significant pandemic that's affected everybody in different ways. So we've got an ambition to make sure that 20% of our workforce are mental health first aiders, and that's something that we're really striving to drive forward with all of our delivery partners.
And what help though is given to trusts to actually implement some of these these models, these initiatives?
Sure. So, I mean, at NHS England, we've got a small but perfectly formed workforce team. They try to put together toolkits and things that will help give people access. We're looking at developing our collaboration hub further. So that's really our key route in and out to our estates community, to develop an app for that so that people can sort of get the information that they need. And we'll be looking to roll out the wellbeing offer on that app. But locally, local teams will have their own policies and processes in place, and we're trying to support the leadership to both bring health and wellbeing up their agenda, but also make sure that the people who really need the information are getting the information that they need to be able to access the services that already exist.
Fiona, thank you so much for your time. It's a pleasure.
Thank you so much.